biological imbalances, there are many reasons a woman's sex drive can tank. With more on desire to disconnect, how the impact of low sex drive can impact your relationship, and more importantly, how to spice it up, is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, it's always so great to see you.
It's great to see you again, Gail.
So Dr. Kathleen, let's talk about declining hormones, because that is one of the #1 reasons that women see a drop off in their sex drives.
Exactly, especially when we're approaching menopause. What happens is that our estrogen level starts to decrease. Even if you do have a cycle, you know that a week before your period, the estrogen level decreases, so does their dopamine, which is a neurotransmitter that our brain needs to initiate sexual activity.
And we also have a lot of body image issues that come into play. I think women are just beating themselves up to the point where they can't be themselves.
Exactly, and when it comes to intimacy, it's not just communication, because that's a huge part of it, which we talk a lot about. But what about the bedroom experience? It becomes the same routine over and over again.
So you say spice it up, even if that means some special apparatus.
Exactly, spicing it up. There's so many different toys, as we can see here, that you're able to purchase on the market, where you're able to spice up the bedroom a little bit more.
And it's not so taboo anymore. I mean, women of all walks, all ages, realize that this is okay and that you don't have to be so embarrassed.
Exactly. I mean, we go to the traditional toys, which is a vibrator. Then we go into something that calls a anal plug, which actually stimulates the arousal part, because as women starts to age, or if you end up having multiple babies, what happens is that the vaginal wall, the vagina starts to atrophy, and so it's not as tight as it used to. So by stimulating certain parts of the body, like the pelvic floor, helps to tighten that vaginal area up a little bit more.
And maybe to take away some of the mundane, check the box, it becomes routine for a lot of people.
Exactly, and then we can incorporate technology into toys too. Something like this, you're able to actually have an app on your phone where your partner's able to control the vibration and how you like the cycles too.
That's interesting.
Very interesting.
Such a thing. So women, so you talk about all of these different things, and they all kind of play in together. A woman should approach her sex life holistically, see a doctor, get a blood panel done, see what's going on, because it all comes into play.
Yes, it can be the decline in hormones that can lower the sex drive. It can be, like you said, body image issues, or it can be vaginal dryness, which we see a lot in our menopausal patients, or even our younger adults. And if that's the case, add in lubrication. There's oil-based and there's silicone-based and water-based. The water-based lubricant actually, it doesn't last as long, whereas an oil-based lubricant or silicone lubricant able to last a lot longer.
Do you think a lot of women, Dr. Kathleen, suffer in silence?
Yes, and I think that what you want to do is that for those male counterpart out there, or women counterpart that wants to spice up the bedroom, just be open-minded and say, hey, let's try something new instead of you're so boring in bed.
Right.
Yes.
So you're just, and should the woman be the one that kind of comes up with the ideas?
It can go both ways. It really depends. If you want to spice things up, just say, hey, I was thinking, let's try something new. And then open up that conversation a little bit. Men are a little bit slower to digest certain stuff, because it might burst their ego, so we have to be, we can dance around the subject a little bit and just create that connection, and that intimacy is key.
If you do look at a patient's blood work and realize that it's something hormonal that is causing them to have a decline in sex drive, how long does it typically take to turn that around?
It depends on which option we'll pick. Sometimes it can take from 3 to 10 days if we choose the pellet therapy, where you insert a certain amount of testosterone and estrogen in the woman's body, or testosterone in a male's body. And delivery system is key too. Sometimes you can offer cream, but that might take a little bit longer. But again, depending on the individual, we have to look at their testosterone and we have to look at their estrogen levels.
Dr. Kathleen, thank you so much for joining us.
Thank you so much.